Hello, I'm Lenore Moudou. Vincent McCurry is off today. This is Africa 54. Tonight, 2 American Ebola patients have been released from a U.S. hospital after blood tests showed their bodies to be free of the deadly virus. Aid worker Nancy Writebol was discharged on Tuesday, and Dr. Ken Brantly was released only a short time ago. Although he contracted Ebola, Dr. Brantly says every precaution was taken.
In March, when we got word that Ebola was in Guinea and had spread to Liberia, we began preparing for the worst. We did not receive our first Ebola patient until June, but when she arrived, we were ready. During the course of June and July, the number of Ebola patients increased steadily, and our amazing crew at Elwa Hospital took care of each patient with great care and compassion. We also took every precaution to protect ourselves from this dreaded disease by following MSF and WHO guidelines for safety.
And both American Ebola patients were treated with the experimental drug ZMapp. VOA's Pearson report on the ethical considerations of allowing experimental drugs to be used.
Without specific drugs or a vaccine for Ebola, the only thing doctors can do for those suffering from this disease is treat their symptoms and hope their bodies can fight the virus. Ebola is killing at least half of those who get it. Experimental drugs have been tried on 6 people, 3 Westerners, and now 3 African doctors. One of the Westerners, a Catholic priest who was working in Liberia, has died. Reports say the other 5 are improving. It's still not known if the drug has helped. The drug they received is ZMapp. The company says all the available supplies are already exhausted. There are also about 1,000 doses of an experimental vaccine available, which may be used in West Africa. Neither of these treatments has been tested on human beings. The World Health Organization decided that the desperate situation justifies the use of experimental drugs. Dr. Robert Klitzman from Columbia University addressed some of the ethical issues in a Skype interview.
Does it work? What should we tell people? What if it makes people worse? We want to make sure people understand if there are risks involved. If we have a limited supply, we need to decide who should get the vaccine or the medication and who should not.
Dr. Klitzman says in some sub-Saharan African languages, there's a word for cure, but nothing that translates the word experimental. He says anyone who receives an experimental drug has to be told it might not cure them, and it might make the situation worse. Dr. Chandrakant Ruparelia is an infectious disease prevention expert at JPIGO, an organization that trains healthcare workers in Liberia. He says even if there were a large supply of these treatments, an untested drug has to be monitored.
That's an experimental medication still, so it cannot be used on a large scale for every patient.
Dr. Klitzman agrees.
We need to give it in a controlled way where we can see who got it, what happens, does it work, does it make them worse.
Other vaccines and treatments are being developed, but are not likely to be used to treat Ebola patients, even in an experimental form, at least not for this unprecedented outbreak. Carol Pearson, VOA News.
The quarantining of a poor area in Liberia's capital due to Ebola has raised tensions and triggered violent clashes. There is a fragile peace in Monrovia's West Point neighborhood after police cleared the streets following an attempt by residents to break an Ebola quarantine. 4 people were injured during the unrest. Residents of West Point say their protest was sparked by the way the police came in heavy-handed to quarantine the area, the deadly virus that has claimed over 1,300 lives in West Africa.